Medical tourism by Nigeria's elite has been the vogue for decades. Their wealth gives them access to the best medical facilities in the US, the UK, France, Germany, and India. The truth is that wherever they can find it, they will go for it. And that they can afford this very expensive but effective healthcare is the reason many health watchers believe they have allowed Nigeria's healthcare facilities to become moribund, if you'll excuse the morbid pun. Over the years, millions and millions of Nigerians have died needless deaths because our poor health facilities are just not up to standard. Hospitals and medical centers in the country have deteriorated so much that they are mere diagnostic clinics. Severe underfunding, inadequate infrastructure, a shortage of qualified medical personnel, and limited access to quality healthcare, particularly in rural areas, are still prevalent in Nigeria. Only a very small percentage, about 5% of the national budget, goes to health. This in a country of 220 million people. Highly skilled medical professionals often leave Nigeria to work in developed countries due to better pay and working conditions, leaving a shortage of doctors and nurses within the country. Rural populations continue to face significant challenges in accessing healthcare due to poor transportation, limited availability of healthcare facilities, and a lack of qualified healthcare workers. Then there is the prohibitive costs. Most Nigerians are forced to pay for healthcare, which can be unaffordable for many, especially in emergencies. And of course, the biggest cancer of them all. Once again, please excuse the morbid pun. Corruption. This scourge within the healthcare system continues to further hinder the efficient allocation of resources and delivery of quality care.
Alongside other equipment.
But Minister Ali Pate says things are changing.
You can see that gradually, piece by piece, we're rebuilding our health infrastructure, both in the front end, but also at the higher level in the teaching hospitals. And we know that important things are happening. People are now beginning from the region to come to Nigeria and receive quality health care. This is already happening, including people from faraway places like the United Kingdom and United States. So despite what we may want to believe about Nigeria's healthcare system, there are good things happening. The transformation that the President promised is beginning to happen. We need to sustain it, and we're investing and will continue to invest in that direction.
But is this really the case? The answer is yes and no. Yes, because many Nigerians who have traveled abroad but are yet to attain citizenship in their new countries do come home for some medical treatments because of prohibitive costs abroad. For instance, the procedure for in vitro fertilization or IVF can cost up to £13,000 in the UK. That's about 24.2 million naira in Nigeria. That same procedure, if done in Nigeria, costs a fraction of that, about 5 million naira. So yes, there is a financial incentive to do it in Nigeria. On the other hand, is healthcare in Nigeria improving exponentially? The answer is an emphatic no. Last year, veteran Nigerian journalist Joy Osiagu traveled from Canada to Nigeria for surgery. She died from complications resulting from that procedure. An example that the minister's words might not be entirely accurate.
We can also trade with them.
But don't take my word for it. Let's find out if Nigerians trust their country's healthcare system.
Like if you check all this primary health care, there's not, so all the equipment there are not well enough. And then see so many professionals that are there, they are not well attended. Some will come and then they will go.
The minister is trying to print the image of Nigeria outside, that Nigeria is working now. But if you go to this hospital now, you'll be the one to go and fetch water for your patient to bath. You can't see anything there. There is no drug, there is no medicine, there is nothing you can even get. So how can minister say, even the minister asks himself, can he attend to himself in Nigeria hospital? He himself. Somebody like me, I don't go to hospital, I take Agbo.
What he says is nonsense because the health in Nigeria is not working. It's not working. How can someone live outside country where even our president fly out to go and get treatment. Then they will now from outside and come to Nigeria where things are not working. It's not possible.
What does Nigeria have that foreigner will be coming to have treatment here? The equipment is zero. If you go to the federal clinic, they will tell that maybe doctors are on strike and the equipment, and they will not even attend to you. So what are the foreigners coming to do? There's nothing they benefit. Rather, they are just telling us a fake news and a fake stories.
If our healthcare system is good enough, why do we have to travel abroad? So I don't think it's not worth it.
And there you have it, the verdict of a cross-section of Nigerians. Had the health minister made the latest statement to ordinary Nigerians and not journalists, he might have been told he was wrong.